So, welcome to this session around careers in medicine and healthcare for refugee background students. So, my name is Pascal Roussel. I work for the Sanctuary Seekers Unit at the University of Leicester, and I'm one of the main organizers for this event for Refugee Week Breaking Barriers that happen every year in the first week of March. So this session will be split into 3 parts. So in the first part, I will have my colleague Sarah from School of Medicine, who will give you an introduction to the variety of possible careers in medicine and healthcare. Then we will have an admissions panel, and we'll be joined by a few more people. We'll be able to answer your questions around how to, how can you apply or get a place, or any question around the courses, the processes to gain a place onto a medical course. And then finally, we will have a couple of students joining us to share their journeys with you. Okay, so before we start, I'm just going to go through a few housekeeping rules. All right, so just so you know, you are all muted, and the reason for this is that we don't want you to appear on the recording, because we will upload the recording on our YouTube channel later, so you can refer to it again. But feel free to have your cameras on if you're happy to. As I say, you won't appear on the recording as long as you're muted. Please use the chat box if you want to send us any messages, any questions, comments. Actually, if you would like to type in the chat now and say hello, then I can make sure you all know where to find it and that it's working for you. Please be kind and respectful, of course. If you have any issues or concerns, you can also send me a private message through the chat. And as I said, we are recording this event, so the video will be uploaded later, and I will send you a link by email as well. So that will probably be next week. And if you have any other queries following this session, you can email us at sanctuary@le.ac.uk. All right, has anyone found the chat? Here, I've just put a little hello in the chat box. Anyone want to say hello in the chat before we start, so I can make sure you're able to find it and put your questions in later? Hello, thank you. Wonderful, people have found the chat. All right, it's looking good. So now I'm going to introduce my colleague, Sarah Addison. She's the Medicine Outreach Project Manager, and she will be presenting the first section of this presentation. Over to you, Sarah.
Thank you. So hi everyone, my name's Sarah. I work in Leicester Medical School, and I deliver lots of outreach. So I go out into lots of schools and colleges, run lots of events on campus to support the public and students to find out more about what it's like to have a career in medicine and healthcare. So hopefully this presentation will be really useful for you, and hopefully you will find out lots of information about lots of careers, and perhaps some that you maybe haven't considered before. So this is what I will cover in this short presentation. So why would you consider a career in healthcare? There are lots of reasons why I think it's a great career, and I'll discuss some of these with you. I'll briefly discuss some of the careers that are available in the healthcare industry, and I'll briefly talk about some of the skills that you might need if you are interested in pursuing a career in healthcare, and how you can go about developing some of those skills over the next sort of few years or months, depending on what your plans are. So why do I think you should think about a career in healthcare? Well, the NHS is the world's 5th largest employer. So it employs around 1.4 million full-time members of staff. So it's a really, really big organisation. It's found in lots of areas. So, for example, people can work for the NHS, but be based in police stations, be based in schools. So there's a really big variety of where the NHS works. Very much working in healthcare, you have the opportunity to make a difference every day to people's lives. So when people are unwell, they can often be quite scared, be a bit nervous, they're not sure what's going wrong, and you have that opportunity to help get them better and reassure them and support them with that journey. And one of the best things that I think is that every day is different. So working in healthcare, you never know what patients you're going to see. You don't know what problems you're going to be presented with. So it's a very fast-paced environment with lots of challenges, and that can be really, really exciting and what lots of people want to get from a career. So they're just some of the reasons why you should think about a career in healthcare, although there are lots and lots of other reasons and positives to think about. So as much as there are the positives, the NHS also is currently facing some challenges. So you may or may not be aware, in the UK, we have an ageing population. So people are living much longer than they have ever done before. Now with that, when you live longer, your body starts to not work as well as it used to. So people are getting more health problems and having to come forward to get support with their healthcare needs. So that is putting a bit of a strain on the NHS as the demand is getting bigger and bigger, so more people need help and support. Another challenge is we're a lot better at knowing about healthcare needs. We've all got the internet, we've joined this afternoon, so we're often quite guilty of maybe Googling what's wrong with us, thinking about what support we should be having. So that can often lead to higher expectations of what we should or shouldn't be having. And that sometimes can be quite challenging with healthcare staff, as sometimes the internet isn't always necessarily the most reliable source of information. So it's trying to balance that out. And another big challenge, and this is especially true with COVID-19, is the advancement in technology. So with COVID-19, lots and lots of healthcare appointments were moved virtually and digitally. So there's an increase in phone appointments, Zoom appointments, and that has had a real positive. So for example, I could speak to my GP sat in my front room, in my living room, and get help and support with my healthcare concerns. But that can be challenging for patients and healthcare staff, as sometimes they might need to see the patient, and it can be really difficult and challenging to know when can we see this patient digitally and provide the right support and guidance, and when can we see them face to face, and do we need to do further assessments. So that's something that's really current at the moment, and lots of healthcare staff are really balancing and trying to get that balance right. There are lots of other challenges facing the NHS, but these are probably some of the main ones. But with that, that means there's lots of positives come from those challenges. So because demand is increasing, we are forever creating new roles and new careers within the NHS, and increasing the number of staff that we take into the NHS. So that means there are lots of opportunities for a career working in the NHS and in healthcare. It also means there's the opportunity for lifelong learning. Working in healthcare, you won't ever finish your sort of degree or apprenticeship or whatever route or journey you take and be done learning. There will be new medication, new technology that you will have to learn to make sure you're always providing up-to-date care and treatment for your patients. So it means we've got to be very keen and passionate about learning if you want to work in healthcare. Also means there's lots of opportunities for promotion and progression. So you'll find often lots of careers they are getting more and more responsibility. So, for example, you can be a nurse, but you can do an additional qualification that will allow you as a nurse to prescribe some limited medication, similar to what a doctor would do. So there's opportunities to develop and progress that way. And it also means the government is looking at more and more routes into healthcare careers. So not only is there you're sort of going to university for lots of the careers, they are expanding apprenticeships and different things like that. So there are more and more routes into some of the professions that I'll talk about on the next slide. So what job could you have? So there are over 350 different careers in the NHS, and I've just put a couple, just a very small handful of those careers on the slide. Some of these professions you have to maybe do some formal training, like an apprenticeship or a degree at university. Some of them you don't always require formal training after you've maybe finished school or college. So things like a healthcare assistant or a porter, you might not always need formal training after that. So there is a big variety in the jobs you can do, and also what sort of routes into those careers that you can think about. But what's really good is that all of these careers work very closely together in what we call a multidisciplinary team, or you might hear it referred to as an MDT. And basically what that means is when a patient is unwell, often lots of people help provide advice and support and care for that patient. So it basically means if you're an expert in physiotherapy, but also that patient's may be having a problem with their speech, we might also need a speech and language therapist, and they work very closely together to manage that care of that patient to try and support their recovery. So you'll find that working in healthcare, you will come across different roles and meet different people from different departments, and you'll work very closely together. So with that, if you want to work in healthcare, you need good teamwork and excellent communication skills, and that's for no matter what role you do in healthcare. Those two skills are essential. So it's something to be thinking about and making sure that you're thinking about developing those skills if you are interested in working in healthcare in the future. So there are, apologies, my front doorbell's just gone. Sorry if you heard that. So there are lots and lots of different types of doctors. So often I sometimes work with students and they say, I want to be a doctor. And that is great, but there are lots of different types of doctors. So for example, there is a doctor of surgery. So a surgeon is someone that will provide operations on patients. An emergency medicine doctor. So someone that would, apologies, someone's just come in my front door and I don't know who it is, so apologies if you hear any. I'm just on a video call, sorry. Apologies. So an emergency medicine doctor, so that's a doctor that works in accident and emergency. So if you have an accident or an emergency and you need emergency care, you would go to an emergency medicine doctor. A psychiatrist, so a doctor that specialises in treating people with mental illness. So again, there's lots of different types of doctors that you could think about becoming. But how you become a type of doctor, so you have to go to university to become a doctor. The government haven't changed that or made additional routes into becoming a doctor. You do have to study medicine at university. Most medicine courses are between 5 and 6 years at university, so it is quite a long time at university. But then you choose the type of doctor that you want to be after you've finished your medicine degree. So if you want to work in accident and emergency, if you want to work with patients that are suffering from mental illness, you would then train after you finish your medicine degree in that type of doctor. And it's roughly between 3 and 7 years further training after that. But all that time, you're being paid in the NHS and you're working in the NHS after you've finished your degree. So that's just to make you aware that if you are interested in becoming a doctor, that's great, but it is quite a long training process. So really make sure it's something you're committed to doing, you're really passionate about doing. It's quite a big chunk of your life whilst you are training to be a doctor. And just to see a little bit about some of the courses we have at Leicester, and some of our admissions tutors will be able to talk about these in a lot more detail shortly. So we've got our standard 5-year medicine course, and then we've also got a medicine with a foundation year course at Leicester. So that's a 6-year course. You'll see on the screen there for our foundation year, there are 35 places available, and if you pass the foundation year, you then successfully go on to year 1 of the medicine, our standard medicine course. But there is certain criteria for our medicine with a foundation year course, and Dr. Sam Adcock will be able to talk about that in a lot more detail later. But that's just to show you there are different routes into studying medicine. So if you are interested in becoming a doctor, definitely explore, as there are lots of routes and different options of how you can study medicine to train to be a doctor. So do definitely look at your research with that. What I will say, and this again, our admissions tutors will be able to tell you a lot more information about this criteria, but most medical schools will have certain qualifications that you might need to have in order to study with them, and this will be different from different medical schools. So our admissions tutors will be able to talk about what we ask for at Leicester, but that might be different from university to university. If you're not sure and you can't find the information, what I will say is always email and ask. The email addresses are usually on the website, and they will usually be quite responsive and let you know if you've got anything specific you want to ask for support with. You will also, for medical school and studying medicine, need to sit an admissions test. Now, there are 2 admissions tests that you can sit. The majority of medical schools ask for the UCAT, the University Clinical Aptitude Test, or the BMAT, the Biomedical Admissions Test. Majority of medical schools ask for the UCAT, but there are a few that do ask for the BMAT. And you usually sit this test the year that you apply to study medicine at university. What's really important to know is there is a cost to taking these tests, but there are bursaries available. So if you are eligible for the bursary, I'd really recommend claiming that, as that's really beneficial for you. But also universities will use that information to potentially make you what we call a contextual offer. So it might be a slightly lower offer than you would normally get, because they can see that you've claimed that bursary. So it's really beneficial to claim that, as universities will use that positively with you. But some medical schools will have a requirement with those tests. And again, that information will be on their website. So it's really important that you do your research and make sure you're sitting the right test for the university you want to go to, and that you are meeting the minimum sort of scores. And again, our admissions tutors in medicine will be able to tell you a bit more about what we ask for at Leicester later. And then all medical schools will interview their candidates. So you will need to go along to an interview and demonstrate why you are passionate about being a doctor, why you've got the skills, the aptitude, and then they will potentially make you an offer after that. So that's the sort of basics of what you would need to study medicine at university. But as I mentioned, there are lots of other healthcare professionals out there. So here's a few on the screen here. So speech and language therapist, paramedic, nurse, occupational therapist, physiotherapist. There are a whole range of allied health professions that are doing similar roles to a doctor, but equally very different roles to a doctor. So it's a lot more niche. You have a different sort of area, and there'll be a different skill set that you will need for those professions. So entering other healthcare professions. So the majority of people train in these by completing a degree at university. And usually these degrees are about 3 or 4 years at university. So it's a bit shorter than medicine. And once you finish that degree, you register with your council or independent body, and then you can start working in the NHS and being paid in that profession. Some professions, and this number is growing, so it's something to keep an eye on, you can also train through an apprenticeship. So a paramedic is an example of one where you can train through an apprenticeship through that route. So again, there's a bit more flexibility with how you can enter some of these professions. So definitely something to think about. So what will healthcare courses look for? So generally, even with apprenticeships and with degrees at university, again, they will look for certain qualifications or requirements that you need. And again, do email in if you've got any questions about that. But hopefully we'll be able to answer some questions in the Q&A afterwards. And again, most healthcare courses will interview again, and that's because again they want to be looking for the best future workforce of the NHS. They want to see that you're passionate about the career, you've got the skills, before they make you an offer to train in that career. So very briefly, these are the 4 courses that we have at Leicester. We will also be having a radiotherapy, diagnostic radiotherapy course launching hopefully in 2023, which is very exciting. For now, we have a nursing with leadership course, midwifery with leadership, operating department practice, and we have Hayley with us, who'll be able to talk in a bit more detail about ODP after in the Q&A, and physiotherapy at Leicester. So I'm nearly finished now, I promise, but what skills do you need? So thinking about the skills you need for a career in medicine and healthcare. So I already mentioned it earlier, you need really good communication skills. And that is for all medicine and healthcare careers, you really need good communication skills. You also need to be very caring and empathetic, as you'll be working with patients. And as I mentioned, sometimes when patients come in to healthcare, they can be quite nervous, they can be unsettled, they're a bit worried, they don't know what's wrong with them. So it's really important that people working in the NHS are very caring and empathetic to provide the right care and support to those patients. Good time management, you will need that in all healthcare professions. As I mentioned, the NHS is getting busier and busier, so we need that good time management in order to manage the patients coming in. Staying calm under pressure, that is definitely true. Sometimes you can be having a day planned and, I don't know, a patient does something you didn't expect or something happens and you need to adapt and be able to stay calm under pressure. You will also need a basic level of literacy and numeracy skills in most medicine and healthcare courses. And that's because you might have to write notes, so talking about what you've done with the patient so that another healthcare professional can pick that file up and see what's happened. Similarly, you might have to deliver some medication and you will need to understand how much of that medication to give. So you will find lots of the careers will ask that basic literacy and numeracy in order to allow you to do that. And I think having an interest in science and technology is really, really key. As I mentioned, lots of the professions, there is lifelong learning as you develop new treatments and new technology. So having that interest will really help keep you motivated when you are learning lots of those new skills. So those are all skills you should be thinking about maybe developing or getting better, or thinking about things that maybe demonstrate when you've shown those skills, because I mentioned for apprenticeships and for degrees, for medicine and healthcare courses, the majority of them will interview people before they make them an offer. An interview, all healthcare and medicine courses will do what we call values-based recruitment. So what this means is they are looking for people that demonstrate the values of the NHS. They want the best future workforce of the NHS, and you can see the values on the screen here. So you would be wanting to make sure you are demonstrating these values at interview, as well as some of the skills that I spoke about. So really look to think about how you can develop your understanding of these values before you apply, and then how you could sort of show that at interview so that you're more likely to receive an offer for the course that you have applied for. And how can you help with that? Well, there are lots of opportunities. So universities are trying to do lots and lots of work with students, with the public, to allow you to find out more about what a career in medicine or healthcare entails, similar to like this event today. But there are lots of other opportunities. For example, at Leicester, we run residential summer schools for students in year 10 and year 11 and for students in year 12. Medicine Calling is a project around mental health careers, and we run events for lots of students as well as parents and carers throughout the year. And we also run some virtual work experience projects where you can watch videos of different healthcare professionals talking about a day in the life. There's quizzes, and you can receive a certificate to put in your portfolio to support your application to some of these courses. So again, there's lots of opportunities to help you find out more and help you make the right sort of career choice for you. And I've just put the website on there where you can go to find out all of the opportunities that are currently available at Leicester. Super. So I'll be around in the next section if anyone has got any questions, but I believe all of our admissions tutors are here and I'm just on time, so I'll make sure we start promptly. So if anyone does have any questions, do feel free to pop them in the chat and I will try and answer them. But if not, I will hand over to our lovely admissions tutors who I believe are all here. And I'll stop sharing my slides so we can see and you can be introduced to everyone.
Thank you, Sarah. It was very insightful to have a look at the variety of career opportunities in the NHS. So as Sarah said, we are now welcoming our admissions panel from the University of Leicester. I will let them introduce themselves. First, we have Margaret Barnes-Davies with us. Margaret, if you'd like to introduce yourself.
Hi everyone, I'm Margaret Barnes-Davies. I'm the admissions lead for the 5-year course for medicine at Leicester Medical School. So that's the kind of standard course.
Thank you, Margaret. And next we have Sam Adcock.
So yeah, my name's Sam Adcock, so I'm a GP, and then I'm the admission tutor for the foundation, medicine with foundation year at Leicester, and also lead on the medicine with foundation year as well.
Thank you. And finally, we have Hayley Quinn.
Hi everyone, I'm Hayley. I'm one of the lecturers on the BSc Operating Department Practice course. So I'm an ODP and ODP lecturer. Our admissions tutor wasn't available this week, but I'm happy to take any questions or any queries about admissions to the course.
Thank you very much. So everyone, if you have any specific questions you want to ask to our admissions panel, please type them into the chat box and we will picking them up as we go along.
The medicine with foundation year is basically a 6-year medical degree. So it's a run-through medical program. So if you get a place on year 0, which is what we call it, then as long as you pass each year, then you will just progress. If there's not another interview, there's not another sort of selection process. And so it's a 6-year course, and year 0 is, as it says, about building a foundation. So it's about developing skills, not only in basic sciences, but about how to write, how to study at university, how to do the exam type that we do at medical school, which is both clinical and written, and just about sort of equipping you with the confidence and communication to do well. So when you move into year 1 and the rest of your course is the same as the 5-year degree, then hopefully you've got all the skills that you need to survive, and not survive, but to thrive perhaps. And so you're a medical student from year 0, from the very beginning, and we do sort of make sure students are aware of that. But in terms of what you cover in that year, so there's 4 modules, 2 which are sort of basic sciences, 1 which is a psychology-based module, and 1 which is taught by the medical school itself as a sort of all about medicine and clinical empathy and communication, and how to bring all your knowledge together, but keeping the patient in the middle of that sort of focus. And then we do a lot of presentations, essays, exams and study skills and things as well. And so that's sort of how the foundation year is built. In terms of our requirements, so there's a few foundation years in the country, and they all do have slightly different criteria, and they're aiming at different sort of groups of people. So just because Leicester doesn't necessarily maybe meet your criteria, there may be others that do. But we are looking for a minimum of GCSEs, so level C or 5 in English, maths and 2 sciences. And then we do say that you have to be within 2 years of leaving school, which might exclude some of the people listening here, but not necessarily everybody. And then we either accept IBs or A-levels, or we do also accept the BTEC National Extended Diploma. So it's BBB, A-level, and we want chemistry or biology plus another one from chemistry, biology, physics, maths and psychology. We're not open to sort of international graduates and access to medicine, but Margaret's going to speak in a minute, and that might be much more relevant for a lot of the people listening today. As well as the academic criteria, we also ask people to meet our widening access criteria. And so to do that, you have to be within 2 years of finishing your qualifications, which again, I know makes it quite tight. And we ask that you've been to a state school to have done your sort of early education in terms of GCSEs. And then if you have refugee status, then that's the only other criteria we would need, or if you've been looked after. If you don't have either of those criteria, then there's a big long list here, which I think people can look at, but you need to have 2 of these criteria to qualify as well. So for those who are listening and perhaps can't see the presentation for the recording, it's about your household income or your postcode, or how high your school that you went to for GCSEs achieved, or if you sort of are a carer or estranged from your family, or if your parents have not been to university, and so you're the first in the family to go. So those are that's a sort of quick overview.
So the standard medicine, the 5-year course, you do a couple of years in phase 1, which is largely in the medical school, and then for the final 3 years you're out mostly on placements, either in hospitals or community placements, placed with maybe a GP such as Sam, or in some kind of placements like that. And that's the way the medicine course works. What we need for entry is we need A-levels with 3 A's at A-level, and that must include a couple of science A-levels. And we need GCSEs as well. We've got minimum requirements for GCSEs. Now, I'm conscious that not all of you might have done A-levels and GCSEs, but we do take a number of different international qualifications as well. So if you've arrived here from another country and your school exams age 16 were not GCSEs, and maybe they weren't even national exams, but you've got your school transcripts, then we will look at those and consider those as well. And that's true for many different universities as well, and many different medical schools, and I imagine other courses such as ODP, nursing, etc. So if you've got international qualifications, don't be put off. We have a number of international qualifications on our website that we tell you what we accept in those in terms of the A-level equivalent. And like I say, you would then write in and let us know what your GCSEs were. As Sarah said, we do have those minimum requirements for English language and maths because of the skills that you need. You might find those requirements are a little bit lower for careers such as nursing, midwifery, ODP, etc. And Hayley might be able to tell you about that. But for us, for medicine, we're looking for you have an English language GCSE, which is a grade B or above, and that's equivalent to a 6 or above, or to have an IELTS of 7.5 or above, with no component lower than 7. We will allow resits in English language and maths as well. So if you've had to retake them, then we will allow that. And as Sarah said, we do require you to sit the university's clinical aptitude test. So that's UCAT. Now, when it comes to UCAT, that forms 50% of the way we score applicants for interview. So we can't interview all our eligible applicants. So we will look through the applications and we'll score them based on the academic qualifications to date and on UCAT. So my advice would be, if you are looking to apply to medicine or dentistry, another course that uses UCAT or BMAT, please do practice those tests a lot before you sit the actual test. You don't actually have to pay for special courses, because they provide free practice tests online. So you can go onto the official websites and get those free practice tests, even time tests. Yeah, that's a really important factor. Another qualification that we accept for medicine is the Access to Medicine diploma, higher education diploma. We only accept it for mature applicants or applicants who have not studied sciences at A level. If you've studied sciences at A level or equivalent and not got the grades we need, then unless there's been some substantial factor that's meant that you weren't able to study to the best of your ability and you've not got these grades, then we wouldn't accept that access qualification. So do contact universities first and check whether they will accept the access qualification in your case before you sign up for any of those courses. So I think I'm going to stop with medicine at the moment, and then maybe hand over to Hayley to let you know a little bit about what ODP is, because a lot of people don't know about it, and tell you a little bit about what it is and about the entry requirements for that.
Thank you, Margaret. No, you're absolutely right. Not a lot of people have heard of ODPs, have heard of operating department practice. I've been qualified 16 years. My mum still thinks I'm a nurse, and it's a common misconception that our profession is nursing. We work with nurses, we work alongside nurses in the operating theatres, but operating department practitioners work as registered practitioners in their own right. I have got a little bit of a presentation just for a few minutes, if that's okay. I won't go through the whole thing. I've just got, this is the one that we normally use, but I'll just go through couple of slides. Okay, so we're based here at the University of Leicester, at the George Davies Centre in this lovely building. And our course is BSc Operating Department Practice, and it is now a degree course. Now, when I did my training, it was a diploma. The course has come a long way in quite a short space of time, and there are lots of ODPs that I know that were actually MVQ trained or even City and Guilds trained. So the course itself has come a long way, and we're now in line with other allied health professions. So we work with physiotherapists, paramedics, and nurses, and we're part of the School of Allied Health Professions here at the university, where we also do midwifery, nursing, physiotherapy at the moment. We're looking, and then we're going to be doing diagnostic radiography as and when, but that course is still being put together. So you might be wondering what an ODP does. Not a lot of people know. If you've ever been to theatre as a patient, then you'll probably have been looked after by an ODP. So we are registered practitioners, and we work in 3 different areas in the operating theatre, and we work in throughout the whole of the patient's journey, from when they come into theatres and right up until when they go through to recovery and leave. Okay, so one of those aspects of our role is that of the anaesthetic practitioner. So we work really closely with our anaesthetic colleagues, so the doctors that have trained in medicine and then gone on to specialise in anaesthetics. they will always work with an ODP, with a trained anaesthetic practitioner. So we kind of partner up with them, and we become part of a small team. We're the ones that check the patients in, so we do a lot of checking procedures, a lot of patient safety procedures. We check all of the machinery. Here you can see one of our ODPs checking the anaesthetic machine. They don't look like that so much anymore. They've come on a little bit since then. We also train our students in all of the different sort of physiological parameters of our patients. They learn about the different anaesthetic drugs that are used. They learn about medication and those actions of drugs and how they react to the body, and how to react in an emergency as well. So part of the anaesthetic role of the ODP is to be very adaptive, and be able to react and sometimes even anticipate certain situations as patients go through their operation. We are also trained as surgical practitioners, so we train to scrub up and assist the surgical. We're part of the surgical team, but we're the ones that open up all of the packs, and we count all of the instruments. We memorise all the instruments, and they're all called lots of different funny names. They're usually named after the person that invented them, so it makes it really confusing. But as you go through your training, you learn about all of the different instrumentation, how to prep and drape the patient, and essentially this part of the role is about ensuring sterility. So we make sure that everything's kept clean and sterile, and that we minimise the risk of infection to the patient throughout the procedure. So we have scrub sinks here in our practical room. We have a simulation room here in the university where our students learn how to scrub up in a low pressure environment. They also learn about we do lots of other different simulations, such as emergency procedures and things that they might not be exposed to on a day-to-day basis, so that students can learn in a pressure-free environment. Another part of our role is that of the recovery practitioner. So when the patient is waking up from an anaesthetic, they'll go to the recovery room or the post-anaesthetic care unit, and there they'll be looked after by either a nurse or an ODP, specialising in this particular area. So here we look at things like pain relief, making sure the patient's comfortable, we check their wounds, and we ensure that that patient is fully awake and safe to be handed back over to the ward or to the admissions unit. So as part of the course, it's a 3-year course, and it's divided into lots of different modules, and our students learn about all aspects of the role of the ODP, and they have to be signed off as competent in those particular areas. So we assess our students through using competency-based assessments. We have exams as well, so they have an exam at the end of every year and a final exam at the end of the course. And we also do case studies as well, where they follow a patient through and then write up about the aspects of care of that patient. And we also expect the students to write assignments as well. So it's quite an intense 3 years. Once registered though, once qualified, and 100% of our graduates go into employment when they are qualified. And even now with the pandemic, we're finding that there is more and more demand for ODPs throughout the country, so it's a job for life. We don't just work in the operating theatres, our skills can extend outside of the operating theatres. This here is a clip taken from 24 Hours in A&E, where my colleague at the top there is standing next to the anaesthetist, is the ODP, and this patient's just come in via air ambulance. So we form part of trauma teams as well, we form part of transplant teams. Sometimes we go to medical emergencies within the hospital, because part of our training is a lot to do with airway management. So we go with the anaesthetist wherever they go when a patient needs to have their airway managed, and that's just another part of our role. But sometimes we can work in high dependency units, we can work in intensive care units, and particularly more so now with COVID. I know a lot of ODPs have been redeployed to intensive care where they can use their skills. So it's a 3-year undergraduate degree. It is a full-time degree at the moment, but we will be offering the apprenticeship very soon. And one sort of unique selling point of our course is that 65% of the students' time is spent actually in clinical placement, working with ODPs, working with surgeons, working with anaesthetists, and they spend 35% of their time here with us. We have 2 intakes a year. So we have an intake in April and we have an intake in September as well. And you can have a look at the website for more details about entry requirements. But if anyone has any questions, I won't go through all of the entry requirements there. They're quite similar to other allied health professions courses. It's 112 UCAS tariff points. We accept A-levels, BBC or access courses, BTEC national diplomas at distinction merit, and we expect all of our entrants to have at least 3 GCSEs at C or above, and we do ask for maths and English. Okay, we we welcome mature applicants. We have students from a massive amount of age ranges and walks of life. And we did have a student last year who qualified, and he was 63. And I think that that's fantastic that people are coming into our profession having done other things and then wanting to have a career change. So that's something that we definitely welcome on our course. I will stop there because it goes into probably a little bit too much detail. And I'm open to questions if anyone wants to ask anything. Thank you.
Thank you, Hayley. That was quite fascinating. Actually, I didn't know so much about that side of things, so I'm sure it's very interesting for any students as well. Partly considering, I think it's probably, well, you've got more opportunities to get onto this kind of program, but it still offers a large variety and quite an exciting career from what I can see. So we had some questions around status eligibility, so immigration status. So as I think you may be familiar with, asylum seekers, for instance, don't have the same rights or access to the same type of funding as refugees. So I don't know if anyone, maybe Margaret, I'm not sure, maybe able to talk about this, or if you feel comfortable or confident talking about this aspect.
So we definitely accept people with refugee status, and in fact we would use that refugee status as one of our contextual markers. So when we're scoring for getting to interview, we would we'd invite the top score ones to interview, and then we create a large borderline, and within that we look at things like refugee status. But when it comes to your status for actually being accepted on the course, if you're an asylum seeker, then at that point we can't take you because it is a 5-year degree programme, and I don't think the funding is available for asylum seekers, and we can't, because it's partly funded from Health Education England and the NHS, we don't get the funding for you if you're at the asylum seeker stage. So you have to have refugee status. And as far as I'm aware, I don't think there are any universities or medical courses that would accept asylum seekers on to study medicine. Unfortunately, you can, I think, get on to study other degree programs. I think it's related to the NHS funding, why you can't come on to study medicine at that stage. I don't know whether Sam knows any more about it.
Yeah, I think from my perspective, I would say I can definitely say that, for instance, sanctuary scholarship that are available for campus-based programs are not available for a medical degree. And one of the reasons is also, you know, it's a long course and it's very, and also obviously there is one part of it that's NHS funded. So even if we could cover you for the first few years, then, you know, there will be issues later down the line. You could apply for courses such as a biological science course that I think can later on help you maybe revert back to the healthcare, to a healthcare career or work in research. And there's also a wide variety in that area. I'm not sure, Hayley, about your programs, whether and asylum seekers could get onto those. That's maybe something we can look at later, otherwise.
I do know that we accept students with refugee status, because we did have a student come through and qualified, but I wouldn't know about asylum seeker status. I'd have to check with the admissions coordinator.
Yeah, I think, there might be some other difficulties, I don't know, around like DBS checks, I think can be a little bit complex as well. So, all right, so I think I'll carry on with some questions. So I've just had one that's more related to pharmacy. I do not believe we offer pharmacy at the University of Leicester. So can you, however, mention any local universities that offer pharmacy and could help answer those queries?
We don't offer pharmacy at the moment, but we may do in the future. It might be something that we're looking at in the future. Okay,
regarding English courses, sorry, Margaret.
I was going to say De Montfort University in Leicester offer pharmacy, so it might be worth anyone interested looking into De Montfort University and what they offer.
Yeah, I can advise, however, regarding the English courses I think this is more for people who were previously qualified in their countries and may need to requalify, or maybe someone would just need to improve their English level and meet the requirement before they can apply for those programs. So at the University of Leicester, so I work for the Centre for International Training and Education, and we offer some courses for students who need to prepare for the occupational English test, which can be taken instead of the IELTS to prove your English level. We partner with an organization, a charity called refugee-background. So I see here we have a pharmacist or someone who wants to become a pharmacist. So I would recommend that you contact the organization refugee-background. They have a website, and then they would be able to help you and also give you some advice on improving your English and preparing for the test to become a pharmacist. And you might be able to do that course at Leicester if they refer you to us. Okay, let me go back because we have a lot of messages in the chat and some questions have been answered directly in the chat, and I'm going to try to see where we're at. Okay, I'm going to ask a general question around access courses, I think. Are there any like local or maybe Midlands access courses that people who may have had interruption with their studies or not quite met the requirement for university for various reasons, if they wanted to, go back on track to career in healthcare or studies in healthcare?
I know that there are access courses at most further education institutions, so any colleges or sixth form colleges. I know that colleges in Leicester and Nottingham all do not just access to nursing, but they do an access to healthcare course. So that is available.
Oh, sorry. I was just going to say, I don't think there are any very local ones doing access to medicine, but you can do it online now, and we do accept the online versions, providing they're the approved versions. I can't remember the name of the body that approves the access courses off the top of my head, but if it's on our website, the approval that there has to be. But yeah, online ones are perfectly acceptable.
That's really useful, actually, because I think that there's been this issue in the past that some courses were not locally available, but online is widening opportunities for our students. So that's really great news. Okay, we have a question about is the IGCSE accepted?
Yes, we're very happy to accept international GCSEs in maths, English, and any other international GCSEs. We're happy to accept that along with access to medicine, higher education diploma as well. For the access to medicine, you do have to get distinctions in all graded credits. So we're looking for quite a high level for medicine. And also, if you have previously done science subjects at what's equivalent to UK A level, then you should really get in touch with any medical school if you're considering entering through the access to medicine route, just to check that you would be eligible. I would advise that for anyone thinking of going in through an access to medicine course. Contact the medical schools or whichever degree it is you're planning to do, and just check that firstly they accept the access qualification you're going to do, and secondly that you meet their criteria. And it might be that you're given some advice to firstly get GCSE English language and maths before you start your access course, or that you're too young at this point to enter through the access route, and maybe it might be more appropriate for you to get a few years work experience first. So just ask those questions. Medical schools, and I'm sure it's the same with all the allied health professions and nursing, etc. The admissions team are more than happy to answer questions if you're not sure whether you're eligible or not. And we all have email addresses on our websites. So the best thing to do is to contact us. Now, we can't promise that we will reply within 24 hours because we do get lots and lots of emails, and the admissions teams tend to be very busy. So just be patient with us, but we will get back to you. So please do email in and ask if you've got any doubts whether you're eligible, or if you need some advice, the best routes to take. And that doesn't just apply to medicine. I'm sure Hayley will agree that you're more than happy to take requests in. It's the same for our physiotherapy department, our nurses and the midwifery team, all very happy to answer your questions, and it would be the same for other institutions as well.
Thank you, Margaret. There is a question around sanctuary scholarships, so I'm just going to take this one quickly because I can answer it. So at Leicester, at the moment, we offer 4 sanctuary scholarships per year. It would usually be 2 for undergraduate programs, 1 for master programs, and 1 for research, although it can vary a little bit depending on applicants. We are also going to have some extra scholarships from September, specifically for Afghans who have recently come into the country. So I think we will have 4 additional scholarships, but that's specifically for Afghans for next year. And although this is not related to medicine or healthcare, just for information, Leicester also offers some distance learning scholarship for distance learning masters, but yeah, those are in different fields, a School of History, Politics and International Relations and School of Business. But we are hoping we can expand the provision in the future and get more people interested. All right, so let me look at all the questions. All right, so in the chat, I'm not sure if there's any questions we have not already covered either verbally or in the actual chat, but I think I will address a few questions that I've had in the past. So there was some question in the past around the UCAT and what sort of decides people need to be competitive.
Okay, so it's difficult in a sense to say what deciles you need to be competitive. So when we talk about deciles, when you sit UCAT, they take all the scores and they split it into the scores into so that there's an equal 10% in each decile. So they just look at the scores for all the people who've sat the test. And obviously, the better your decile, the better your chance of getting a place in medicine is. However, having said that, you don't necessarily need to be in the top deciles. And if you have refugee status, then it might be that you're in that borderline group, and we will take that into account. I would say that if you're come out in the lowest 3 deciles of UCAT, then you've probably not got much of a chance of getting a place to study medicine. So that's why I said that it is best to really practice those admissions tests, to go on to the website, use those time tests that are available. And they've got question banks as well. And I think they also provide a kind of time scale of when an advice for what stage you should be at. I would also say book your test quite early. So register early and book the test. Book the test so that you've got enough time to practice, but don't book in to do the test in the final week of testing, because if something goes wrong, then there's no time to redo it. If you have to cancel your test because you're ill on the day, there won't be time to reschedule it. And if a test like UCAT is a requirement, then it's simply a case of, if you don't have a UCAT score, even though you've got a really good reason, you were ill when you were due to go and sit your UCAT or something, then you just won't be considered. So you must have that UCAT. Most medical schools, it is UCAT, and dental schools as well. There are some of them that use BMAT. The difference between UCAT and BMAT is, with BMAT, there's more science in it. So there's papers that are around science. UCAT doesn't require any specific knowledge. It's not a knowledge test. It's testing skills like your verbal reasoning, your numerical skills, etc. And there's something called a situational judgment test. Now that gives you different scenarios and asks you to choose what would be the best thing to do in that case. And I will say that the situational judgment test is something that a lot of students from an international background struggle with a little bit. Maybe because there's a difference in culture, so they would choose a different option. Or it could be, if English isn't your first language, you might struggle a little bit to interpret the questions. So I would pay particular attention to practicing the situational judgment test as well, and looking at the rationales for why the correct answer or the most appropriate answer is the one that it is. So if you get it wrong in your practice, look and think, why should it be that one, and try to really develop a good skill at doing the situational judgment test.
Thank you, Margaret. That's excellent advice. Actually, you mentioned timeline, and actually as something that we may want to spend a little bit of time on. What is the timeline to apply to university, particularly when you're applying to medicine? Because I know that things happen a bit earlier for medicine. So could you take us through maybe the timeline for all the things that they need to prepare, and then in terms of the application itself and interviews and everything?
Yeah, happy to do that, unless Sam wants a turn.
Yeah, so I'm happy to chip in. So in terms of the timeline, every medical school in the country has the same deadline. So we won't accept applications. So the deadline's the 15th of October for the entry the following September. So that's the deadline that you have to submit your UCAS application. And obviously, to do that, you need your aptitude test or BMAT, UCAT, whatever it is, plus all your qualifications, or at least tell us which ones are pending. So that's the deadline that we all follow. And then interviews happen variably between different medical schools. So most medical interviews can take place really any time between December and April. And it often takes medical schools a few weeks and months to get through all the interviews that they need to do, because they're interviewing hundreds, if not thousands of people. So the timeline, it stretches things out. So our deadline is much earlier than everybody else's deadline. And then often our offers are coming out much later than everyone else's offers. So it is a long-winded sort of process. Anything else you'd add to that, Margaret? I think that's probably the sort of time. And then obviously the courses normally start September, October, depending on the university of the following year.
No, I would say that's good. But in terms of the UCAT, you have to have the UCAT before you apply. So UCAT, you would be looking at registering for it in May, I think, and then the testing starts in July and finishes in September. So that's the kind of timeline. The UCAT is done before you apply, so you apply once you've got that. And I know that the timeline is obviously very different for ODP as well, and for other courses at university.
Yeah, we accept applications because we have 2 intakes. We accept applications most of the year, to be honest, up until a couple of months before we start. So yeah, different kind of timeline.
Are yours all through UCAS?
Yes, through UCAS, yeah.
Thank you for clarifying. Yeah, I think that not everyone is always clear with the timeline and realize that things happen much earlier for medicine, and there are all those additional steps you need to prepare for.
We've now got 2 current medical students with us who are going to talk a little bit about their journey into studying medicine, so why they decided a career in medicine was for them. And then they'll also be around if you've got any questions about what it's like to study medicine at the University of Leicester. Do just bear that in mind, they are University of Leicester students, so what they will be talking about will be specific to Leicester, although hopefully you can take away some of that and apply that to other universities. I do apologise. I did have another 2 students that were also supposed to be supporting healthcare students, but unfortunately their placements got changed rather last minute, so they sadly couldn't support the event and they've had to go out on placement. So I apologise. It is a bit medicine specific, but hopefully lots of things they talk about placement and things like that will also be applicable for lots of other healthcare careers. So I believe it's going to be Harriet that will go first, and I'll just get your presentation, Harriet, and then followed by Adiba. So bear with me 1 second and then we'll get started.
Okay, lovely. Thanks, Sarah. Just checking you can hear me okay. Yeah, lovely stuff. Well, lovely to meet you all. My name's Harriet, and as Sarah said, I am a medical student at the University of Leicester. I'm actually in my final year, so I've got my final exams coming up on next Monday and Tuesday, actually. So even alongside kind of any medicine specific questions, any questions you have kind of about studying healthcare or even just being at uni, I'd like to think hopefully by this point I know a little bit about what it's like to be a uni student at least. So I'm just going to chat to you just briefly this afternoon now, just a bit about kind of my journey into medicine, and then a bit about kind of why I decided to do that, and then also kind of what I've been enjoying most about my course so far. So I've got a few pictures here on the slide which hopefully you can all see. And they're kind of really what was going through my thought, kind of through my mind, if you like, before I decided to apply for medicine. So we've got this little chappie here on the left. He actually doesn't look like that anymore, sadly. That is my little brother, Zach. He's neither this cute or this small anymore. He's actually 15 now, which kind of shows you how long ago I started thinking about becoming a doctor. And so it kind of all kicked off for me really when he was born. I don't know if you can see there behind the cute glasses, but he's got a little bit of a squint in his right eye. So we were back and forth to hospitals, me, mum and little baby Zach, and going to kind of lots of different appointments. And rather feeling kind of worried and stressed like my mum was, I kind of thought how amazing it all was. I thought the people that we were seeing were just fab. I thought they knew so much, and he actually has had that corrected now. I should have done it before and after. So I just remember thinking just how fab that all was, and thinking, you know, how could I maybe get involved with that? So that was kind of the beginning really. I knew kind of nothing really about healthcare. Nobody in my family's gone into healthcare. They're kind of all very English and history based in terms of what they enjoy. So kind of following on from that, I thought it was quite important to do a bit of work experience, kind of actually get to see what it was like, and see whether or not the day-to-day was for me. So I managed to organise just a week's experience kind of shadowing in a hospital. And it went really well. I really enjoyed it. It was really fast paced. All the people I met I thought were so interesting, and I felt really privileged that lots of the people I met were really kind of open and honest. Did a few events like the one you guys are on today. So was me, the city, and all that good stuff. The Leicester Medical School there on the right. It says at the bottom there, I did come straight from school and I did study. I've got lots and lots of friends who have done various different routes. So then I guess kind of what's happened since then. Well, so I've had 2 years of lectures and 3 years of kind of clinical placements. I definitely have absolutely loved my clinical placements. That's definitely my favourite bit. We rotate around kind of every few months or so, kind of the different specialties. And there have been some that I've absolutely loved, some that were a really great experience, but I now know aren't for me. So it's been really interesting. I think my favourite bit definitely still is meeting the patients, kind of even from going on that initial work experience and chatting loads and meeting lots of different people. That still is my favourite bit. If you put me in a GP surgery room, I'm very happy covering every 10 minutes, getting a new face to talk to. So that's probably my favourite bit since then. Yeah, so that's kind of why I came into medicine, initially just because I was a little bit nosy and interested. I guess to finish off, why am I in medicine now? And why do I still think, even though I'm kind of that bit older, why I still think it's the right career for me? It definitely is because it's very kind of patient facing. No 2 days are the same. I get kind of bored a little bit easily. So there's not room for boredom in kind of any healthcare career really. And then also as well, I think it really kind of beautifully couples with that scientific aspect. So the things that I'm learning to kind of support those face-to-face interactions, I just think is fab. And again, is changing all the time. So I don't know what my future will look like. I'm still not really sure what kind of doctor I'd like to be, even though I potentially will get some jobs this August. But, you know, I know they're all going to be with people. So that is fab for me. So that's a bit about me.
Thank you, Harriet. That was really insightful. So if anyone's got any questions they'd like to ask Harriet, do pop them in the chat. And without further ado, I'm now going to hand over to Adiba, who's going to share her journey. So I will share you and share your screen now.
Hi everyone, my name is Adiba and I'm quite at the opposite end as Harriet, so I'm a first year medical student. So I've just started, and this is kind of just a little roadmap I made of my kind of journey to medicine. So I always enjoyed the sciences, and I really enjoyed like physics, chemistry, biology, which you can see at the bottom. Those had always been my passion, but I wasn't sure where I wanted to take it and how I would like go about it. So the first kind of thing I did was organise a hospital work experience, and I think that really changed it for me, and I really, really enjoyed it. I did mine, I don't know if you can see, at Hayward House, which is actually palliative care. So that was really insightful and kind of showing how compassionate and empathetic doctors really are and how much they really care about someone, and it helped me to understand the privilege that any healthcare worker is really in treating people who are so vulnerable and almost like in so much pain and helping them. So I think that was really insightful for me. And yeah, and I've just put a couple of virtual work experiences that have been going on because I know it might be a bit difficult to arrange things like that at the moment. And then I've included a couple of my hobbies, so things that I did. So I did fencing, which is a bit different from the norm, and it was quite interesting, and it really helped kind of help me in terms of team working and developing kind of transferable skills. So I'd say definitely continue with all your hobbies. And I also enjoy baking, which I think you can see over there. I also did St John's Ambulance, which really helped as well in kind of seeing the applications of first aid care and how what it might be like working in those kind of scenarios, which is really interesting. And I also really enjoyed the aspect of the lifelong learning in terms of medicine. So every day you learn something new, which really fascinated me because I like to learn new things, and I'm a bit geeky like that, but what can I say? And I think even as a first year medical student, every day is just so fascinating because you're learning things you would never even imagine, and it's just amazing. Obviously I haven't had as much clinical exposure as perhaps Harriet, but in terms of lectures and things, I'm really enjoying it, especially with all our modules. So yeah, that's a bit about my journey, and feel free to ask me as many questions as you like. I'm more than happy to answer anything.
Thank you, really, really insightful, and nice that you're both at very different stages of your journey. Just to sort of reiterate, if you've got any questions you want to ask either of the students, do please pop them in the chat. I'm just going to close the presentation quickly and just spotlight you both so that we can answer questions. So I've just got a question for both of you, which I know often comes up a lot, is how do you find the work-life balance, which I know lots of students often worry about. They think medical students are going to be in lectures all the time. So I don't know if Harriet, you want to share, followed by Adiba, your experiences.
Yeah, sure, of course. I've heard this a lot over the last 6 years, kind of when you meet people, and especially in that university environment, you're first meeting somebody, kind of the conversation naturally goes, well, you know, what are you studying? And the second I say the words medicine, everybody kind of slightly recoils and is a bit like, oh, and what are you doing here out of your room or of lectures? And it's, I mean, just in my personal experience, that's really not been the case. I personally haven't particularly struggled to kind of get that work-life balance. And I think that's probably because, as I'm sure lots of you here at this event are today, we all kind of have our own life stresses going on, and we all have our own responsibilities. One of mine just so happens to be revising for a medicine degree. And so I think massively it's just about time management. I just try and stay on top of my workload just like any other student would, and kind of make my notes kind of as promptly as I'm able to after the lectures, making sure I've understood it. And there's inevitably going to be those periods in the year that perhaps you see a bit less of me because I'm trying to cram a bit more revision in. But I'd say on the whole, it's just been about being organised, really, and making sure you are still saying yes to those plans, because it's really, you know, sometimes a bit tempting to kind of continue on and think, oh, there's always more to learn, which there is. But you also need to kind of stay human and stay yourself, and that knowledge isn't going to go in if you've got kind of that higher level of stress. So I've just continued to say yes to the things I enjoy. I try and keep my weekends spare, which I know doesn't work for everybody, but for me it's worked really well, kind of knuckling down Monday to Friday, and especially at least taking one of those weekend days as a break has been quite a good method for me over the last 6 years or so. But it's interesting, actually. I don't live with medics at the moment anymore, and before I moved in with them, I think they thought I was going to be this big kind of just big brain machine, and that's all I was going to do. And actually we're all very similar because we've all got our own responsibilities. It's just about making sure those to-do lists are filled out on a Monday and finished by a Friday for me.
Thank you. Adiba, do you want to share any or add anything additional?
Yeah, so very similar to what Harriet said. It can sometimes feel a bit like, oh, there's so much to do, very overwhelming. But I think if you kind of stay in touch with your hobbies and things that you enjoy, you definitely can find that balance. And I think it actually helps in maintaining those breaks, because it can sometimes get very work focused, but having them in between, it kind of provides a break and a relief from those. So I think it's definitely important to find that balance, but I think we're all getting there.
Thank you. Another question I I don't know if we've had any come through just yet on the chat, but it's about sort of part-time work. So again, lots of students worry about sort of the finances of a medicine degree over 5 or 6 years if you intercalate. So just if you could share your experiences of being able to get part-time work, as obviously you're both working today, so hopefully you can share a little bit about some of the options available. Adiba, I don't know if you want to start, followed by Harriet, just to mix it up a bit, because you might say some similar things.
Yes, so definitely. I think part-time work really helps in terms of just kind of using your spare time to get a bit of money, really. It helps in that way, and you definitely do have time. I think you have to manage kind of plans around it and try and work around your timetable, but I think there are definitely lots of opportunities, especially as you can see today, we're both here, and yeah, I think that's mostly what I have to say. I'm not sure if I want to elaborate.
Yeah, and again, I 100% agree. I think perhaps all I'd add to that is something I've found particularly helpful when looking for part-time work. And again, it's something I've massively relied on, not just for kind of that extra kind of monies, but personally, like for making sure I can pay my rent and make sure I've got enough kind of money for bills and whatnot. I, in my first year, went along to one of those kind of many student fairs they put on, and kind of bumped into the schemes where you work for the university. And I've been working for the university in kind of various roles over the past 6 years, and I found that is just the best way that I've managed to maintain a part-time job. Kind of the benefits of working for the university are that your education will come first. So just like Sarah was saying, how there were supposed to be a few other students here with us today, but they're out on placement, that's completely understood, and actually that placement does take precedent. Whereas perhaps in a job that isn't linked to the university, they might not understand that quite as much, and that might potentially be a bit difficult. So my first tip would definitely be to try and work for the university if you can, because they're always going to support your studies. And then secondly, if you are, as I assume most of you are, kind of maybe perhaps interested in healthcare careers, it's actually a really great way of doing part-time work in your chosen field. So for example, I trained up as a healthcare assistant at the hospital that I was doing placements at. So not only is that earning me that extra money to help me live and support me to live, but it's actually boosting my clinical skills, which has been fab. And then more recently as well, kind of working alongside the vaccination schemes with COVID, being a healthcare student kind of gave me those relevant qualifications to be able to put myself forward for those sorts of roles as well. So there's definitely lots of opportunities. It kind of slightly kind of hangs on the back of the last question. If you've got that work-life balance, then it's completely doable. And actually, I absolutely love working for the university because I'm working with lots of students similar to my age. And so that almost became kind of a bit more of like a, not completely a social thing, but slightly social, slightly work. And that's just like the best of both worlds, especially if you're spending all Saturday on an open day. It's, yeah, it's been good. So I wouldn't worry if you are needing, like me, to work whilst doing your studies. It's definitely doable.
Thank you both. I know I've got one more question, and I don't know if Pascal's got any or any other students have got any. But I was just going to quickly ask again, lots of students often ask about the assessment during medicine degrees and what that sort of entails. So I don't know if Adiba, you want to maybe start with maybe some of the first year, and then Harriet, you can maybe talk a little bit how it changes as it progresses through. That'd be great.
Yeah, of course. So our exams are quite, so MCQ, so multiple choice questions, and then written answer question focused. We just had ours in January, so had that over and done with, thankfully. And I think definitely not a thing to worry about, as long as you kind of stay up on top of your revision and try and break down the workload. I think you can definitely get better exams. We also have formative OSCEs, so that's when you start to talk to patients, discussing with them like their history and things like that, but we haven't been examined on those very rigorously, as I'm sure Harriet probably has better experience on that. And yeah, so I think exams are kind of looming around throughout medical school, but I think if you stay on top of the workload and maybe make revision timetables and things like that, they definitely are very manageable.
Yeah, for sure. So, I mean, and every medical school will be different, or every kind of healthcare course will have their own examination schedules. Just to give you a bit of an idea of kind of what I've sat in the last 6 years, then I guess. So, just like Abdullah was saying, they're kind of in the first and second year, I had examinations twice a year. So, like just like you said, they were kind of one that's called an OSCE, which I describe it to my friends a bit like speed dating with patients. Kind of a bell goes off and you've got 10 minutes with one patient, and a bell goes off and you've got 10 minutes with the next one. And that's to showcase those practical skills. So I've done now 5 of those in total, so 1 every year. And then we also do have those kind of written papers as well. And then just to kind of top it off, in my final year, there are just kind of a few extra exams that you sit to kind of tie off those loose ends. And I'm sure this will be similar with most healthcare courses, and they focus on kind of those specific skills that are relating to that course. So, for example, I've sat a prescribing exam last month. I've sat an exam called a situational judgment test, which is focused a bit more kind of on ethics and how you would respond in kind of work-based scenarios. So there's a whole range, and if you're anything like me, you might be kind of more confident at some and find other styles a little bit tricky. But that's kind of the beauty of them using lots of different styles, that hopefully you'll be able to shine through in the ones that suit you best. And if you're anything like me, kind of stumble through perhaps some of the ones that are a bit trickier. But in my experience, they've been completely fine, and actually they come at the end of lots and lots of learning, so they're often very fair. So yeah, that's kind of what I've done. It sounds like a lot kind of now, I think, perhaps, you know, people ask me afresh kind of how many exams I've done, but they come at you relatively slowly, so it's very manageable.
Thank you. I actually have a question that we sometimes get around any additional costs, or like equipment and materials you may need to buy, or how do you manage your budget? Is there any support available? So whatever you've experienced yourself, I think will be helpful for students to find out about.
I'm happy to kick off on this one. So this is not actually something I considered before uni, and it hasn't played a massive role, I'm pleased to say, kind of throughout my degree. I'd say perhaps the surprise costs for me over the last 6 years have been considering kind of travelling to and from placements. So if I'm sent a bit further afield and I can't just use my 2 little legs to get there, kind of the cost of either that petrol or running a car or public transport. I do know that lots of medical schools are aware that this potentially could be a barrier, could be an issue. So at Leicester, there is a sum of money that you can claim back for some of these travel expenses. And I also did access something called a hardship fund that Leicester offer as well. So there are lots of grants within the university if you really are struggling to fund something that's course mandated. I've never been left in a position where it's kind of sink or swim. That hasn't been the case. And then again, I'm not sure about other universities, but I think the second thing that lots of people think that you're going to need to do is buy lots of textbooks. And that definitely is something that some of my friends have done. I am proud to say that I have not bought a textbook in the last 6 years of uni, mostly because the library has absolutely loads of books, and if it doesn't even have what you need, you can request it, and they will buy it for you and even pop an ebook online, so you can download it and not even have to carry the whole manuscript around. So I haven't personally found that buying kind of textbooks has cost me lots and lots of money. It has cost me £0. But maybe that's me being very frugal. Yeah, I'm trying to think. Other than that, I asked for a stethoscope for Christmas. That's, I guess, an expense. I got a very nice discount from a student fair on it, and it's lasted me 6 years with a nice little Harriet name on it, so it can't be stolen by consultants. But other than that, I've not found kind of massive extra costs. And like I said, that time that I did when I was kind of paying for a bit further afield travel, I spoke to the university about it and accessed some help with funding. So I've managed. I don't know if you've got a completely different experience. Maybe everybody started buying textbooks in first year.
Yeah, so similar to Harriet, I think textbooks was quite a major concern for me before coming to university, but there are so many online ebooks available and online resources that actually get signposted to us, so they send the links for them and things like that, so you can just read through those and they're more than sufficient, so definitely not to worry about. As Harriet said, there are so many student discounts on stethoscopes and things like that, so people do help out in that way. And I think another expense was the lab coat, that again on Amazon you can get them for quite cheap, and I think the university encourages that as well, so it's quite great in that way. And yeah, I don't think other than that there were too many other costs.
I guess I've just got one more final thing to add, and I'm sorry that I can't add to this because I didn't buy any books, but there are also as well often, and I'm sure this is common across other universities, where the new students tend to be in big Facebook chats, and us older students still kind of have one, and then we kind of have a master group page where all the medics are dumped on, and on there often the older students that are progressing on and getting jobs will say, you know, I've had this textbook, I thought it was decent for this module, you know, does anybody want it, or does anybody want it for £2? It's you know, I personally wouldn't buy books before you come to university, and there are lots of opportunities, if that's how you prefer to learn, to get them for a far more manageable price than ordering them new. And then also you get some people sneaking notes along the side, which I love. That's been my experience.
Great tips, ladies. Actually, I've got another question, maybe for Adiba, because you're in your first year. I thought it would be interesting for students to know what you learn in first year of medicine, kind of the structure of the year, and maybe of the next few years after that at Leicester.
Yes, of course. So obviously I'm speaking for Leicester Medical School. I'm not too sure about other medical schools, and I'm sure they'll be pretty much the same, but a bit of jiggle from here and there about the way it's structured. So for us in our first semester, we learn about so the basic mechanisms of the body, so similar to what you may have learned previously about like genes and genetics and things like that, and also things like how different organ systems work in the body. So we kind of focused on the endocrine system in our first semester, and moving on to second semester at the moment, we're looking at a lot of anatomy, which I know can be quite dividing in terms of students and how they feel about it. As a lot of people have told me, it's like learning a new language with all those terminologies, but it's very interesting. And at that point you can kind of go more into dissection rooms and have a look at specimens and things like that, and prosections, which is a very interesting experience. Also at the moment we're learning a bit about infection, which is quite relevant at the moment considering situation, and we're also doing a bit about the cardiovascular system and how the heart works. So these are your first year modules. I'm sure Harriet probably has insight over the other years.
Can she remember what she studied?
That is the question. The answer definitely should be yes, with Monday looming. Yeah, for sure. So it's it kind of starts off like you say in kind of this system-based learning, and you learn about the normal working function of the body and what you'd expect to find. And then as the course kind of progresses, they start introducing kind of those more disease-related processes. So you've got that baseline knowledge of how it should go right, which helps you to understand more why it might go wrong, and how we might fix it if it goes wrong. And then in my placement years, we focus more kind of on speciality learning. So when I say speciality, I mean things like ophthalmology, so the eyes, or you might spend time in orthopedics, so you're more looking at bones. And the focus there is more so on patient communication and that kind of management side of things. So if we've learned how it should go right, what goes wrong, and then in placement, how do we kind of fix it, is kind of how I've understood stuff that I've been taught. But yeah, that's kind of how the structure goes. And it tends to be a lot more kind of lecture focused in the first few years, so they don't just kind of dump you in hospitals and expect you to be able to understand what's happening, and then more the placement focus for the latter 3 years. But again, different medical schools have different structures, so there's lots of options to kind of find what suits you best.
I've got it's pretty final question, since I don't think we've had any more for you ladies in the chat. So you've said you've got to travel for some of your work placements. Where have you had to travel? What are the locations, hospitals where you've had to be?
So I've done a bit of a tour of the Midlands. The Midlands is actually home for me. So home, I love the Midlands. I'm always kind of at least an hour and a half from my parents, which has been lovely. So that's one thing that I think I would probably, if I could do it again, I think I'm very lucky that it's worked out very well for me at Leicester, because I didn't consider kind of this aspect of healthcare learning, and that is the catchment hospitals that the university provide to. Some of the catchments for some schools in all sorts of healthcare careers have really wide catchment areas. So if you're thinking perhaps about going up to Scotland, they cover a really massive area. Whereas being in the Midlands, and there's a few medical schools local to us, that catchment area is a little bit smaller, but still somewhat decent. So you'll have to excuse my geography because I'm awful at it. So if Leicester's in the middle, I've been sent to Kettering, Lincoln, Boston, Northampton, Burton. Was there anywhere else? Oh, lots of Leicester placements as well. So there is a variety, and they try and split it fairly. So we call those out blocks. So they try and have a balance of those out blocks and in blocks, which is in Leicester itself. But it is a little bit of travel involved as well. But I've seen some beautiful places that I wouldn't have gone to otherwise. It's just getting there and getting used to a different bed, which, if you're anything like me, is not my big love. So lots of traveling, but also experiencing lots of different hospitals as well.
Yeah, thank you. That's a very important point to make. I think a lot of people don't expect to have to travel to various places for their placement and spend maybe a few weeks there in hospital accommodations, different conditions. So I think it's helpful to mention it. I think that's all of the questions for our lovely students here. I'm just going to address one question that came to me as a direct message that's not related, well, it's not really for you ladies, but I've just had a response kindly from Sarah, so I'll just say it out loud. So we had a question from someone who has been a support worker for 4 years now, and who would be very interested in applying for a similar job working in a hospital or the NHS, either as a carer or support worker. And that person has got some training qualifications related to support work, but they don't have any GCSEs. And so they would like to know if they could apply for a position in the NHS with their existing qualifications. And Sarah has replied that often carers do not need to have GCSE. There is no GCSE requirements, and they would look more at your experience. But of course, you would need, a certain amount of English language, obviously, to be able to communicate with the patients. So if there are no more questions, we are just on time to close our event. So I would just like to say a massive thank you to all our speakers today. I think it's been very insightful. It has been for me, and I'm sure it has been for our participants.